My name is Will Jones, and I'm very happy to be with you here today. Moi, c'est William. Je suis très content d'être ici avec vous tous ce matin. I gave out more Narcan probably than most people ever will in their life. So for me to be here, it's not about politics. It's not about a policy position just to talk.
We're really here for one reason, and that reason is to help decision makers and the public navigate this complicated issue with common sense, evidence, empathy, care, toward the goal of prevention. But when we lean on these lazy dichotomies, intense police involvement or none at all, a lot of treatment, none at all, we get bad outcomes. And so I think the good news is, there's a lot of good news. Part of the good news is there are things that work, and we're going to be highlighting that.
He said to me, Brad, what stopped me from getting help wasn't stigma from drugs being illegal. It was a 16-week wait for the type of treatment that I needed. That's what stopped me.
I hope you'll join me in feeling a sense of warmth that we are at last in a room together, talking about making a better place, free of judgment and blame, looking out our windshield, not necessarily in the rearview mirror. We have immense, immense strengths. And I hope we can continue this discussion and put some of them into better
BC Housing has put consumption rooms in all their buildings. So where you have consumption rooms, you're going to have dealers, because when you're consuming something, you need to get it. We need dry housing.
And unfortunately, many of my patients fall into this revolving door where they come into hospital, they receive excellent treatment, and we put them right back into that circumstances. In some ways, for me, it's analogous to treating somebody with a gambling addiction in a facility and then discharging them right into a casino and saying good luck.
We need to provide local treatment options to use so they can be close to their families and receive programming which is culturally safe. There is unanimous support from the community and youth for the creation of an Indigenous Youth Wellness Center, which will offer detox and residential treatment on Vancouver Island.
That as we are creating programs for communities, we need to be really careful we're listening to what the communities want.
I'm gonna pound my drum here. This drum is an extension of my heart. It's an extension of most Indigenous communities. That's why we use the drum.
I don't think that saving lives is just CPR. I don't think that saving a life is just Narcan or just housing. Saving a life is getting somebody in a condition to where they'll never need your help again. Saving a life is living a life, helping someone get into a place where they can live a life free of addiction and the suffering that comes with it.
No epidemic in the history of the world has ended by waiting for people to get sick and then trying to take care of them. That's not how COVID ended. That's not how HIV was brought under control. It's through prevention, stopping people from getting in trouble in the first place.
Even the information that we do get out of the health authorities are so watered down and broad brush that it's not useful. So we've had to try to reconstruct things ourselves.
It's serious what I talked about. You can't manage what you can't measure. I really believe that.
But most of them, they are nurses, teachers, and they are hardworking taxpayers raising the next generation of Canadians. Their voices deserve to be heard.
This is the beginning, though, and we do want to have discussions and dialogues. We want to bring people together. We want to bring people that may not agree together and find common ground. We want to come up with real solutions, actually, and promote those solutions. So you will hear from us. This is the very beginning, and again, thank you all for coming today. Thank you.